Alright, still on the case of Nnamdi Kanu's health issue. Believe me, this is not a good news we are receiving. Some lawyers and his brothers included has gone to visit him, and the report they are giving us right now is not a good one. Well, in the report, they said that Nnamdi Kanu told them that the DSS has collected his blood for more than 50 times. Yes. And then you may ask, for what exactly? According to them, the last time they took it for sample, and they went to a hospital in South Africa. The DSS took samples of his blood. Oh yes, you heard me right. They took his blood to a hospital in South Africa to test what is wrong with him. And after listening to this, I began to wonder, is there no other hospital in Nigeria where they can take his blood? What is happening? Like, what is really happening? Now, aside from that, he said that he's developing some symptoms of sickness that he knows is not in his body, that he's feeling all the whole symptoms now. After listening to this, I began to think, are you sure that they have not poisoned him? Maybe in Nigeria here, or probably when they, caught him in Kenya, when they kidnapped him from Kenya. Honestly, who knows? Who really knows what is really happening? So guys, I'd like guys to listen to also what Nnamdi Kanu told his lawyers. And also, if you're coming across my channel for the first time, do it to hit the subscribe button, like and share this video, and drop your comments in the comment section below. What you guys really think about this video? So guys, watch this video and I'll be right back.
Okay, good afternoon, lovers of freedom. Today is the 17th day of September 2025. We just came out from a visit to Nnamdi Kanu, who is in solitary confinement at the DSS. We had a meeting with him a short while ago, and this is the message he has sent, or he has asked us to send out to the world concerning the status of his health. This is Nnamdi Kanu talking. The SSS, through their doctor, who was brought to replace another more competent doctor, that actually discovered that he has a very dangerously low potassium in his bloodstream that can trigger heart failure at any time. This doctor, who is of DSS, is fully aware of the seriousness of the potassium depletion in his blood system. And yet, the DSS took samples of his blood system, his blood samples, in South Africa for analysis. The South Africa authority, after analyzing the blood sample, queried why the depletion of potassium in his body. The lab people in South Africa could not give any reason for the depletion of potassium in his system. The DSS facility here has also not been able to show or give reason why the depletion in potassium is consistent and persistent in his blood system. And the question Nnamdi Kanu is asking is, if there is nothing wrong with him, then what is the reason for the taking of blood samples from him for almost over 50 times? Why the consistent drawing of his blood in the name of going for analysis for more than 50 times? Why is it that his potassium continues to deplete despite all the medication that the DSS have been giving to him? To Nnamdi Kanu, we strongly believe that the medicines given to him by the State Security Service and Medical Department is of no effect whatsoever. He also wants the world to know that he may have been poisoned in Kenya to the knowledge of the Nigerian authorities, but yet the Nigerian authorities choose not to give him the adequate medical treatment that he needs for his survival to face his trial. Nnamdi Kanu wants us to know that since he was born, he has never suffered diabetes before, nor has he suffered anything post-trem before. But due to the depletion of the potassium in his body, so many things have started going wrong with his internal organs. His pancreas, his prostate, and so many other things. His heart, so many other things. The kidney function is not functioning at optimal level. It's Nnamdi Kanu's belief that the Nigerian judiciary is seriously being intimidated by the authorities. And that is why it appears that the judiciary is not helpful to him when it comes to issues of his health. Professor Araj, Professor Emeritus, a medical doctor, who is currently leading his medical team, had proposed to affidavit stating what he found that is wrong with Nnamdi Kanu and recommending that Nnamdi Kanu be taken before the National Hospital, which is a federal government-owned hospital, for proper medical attention. But unfortunately, the federal government of Nigeria, through the State Security Service, have refused to see reasons why he should be taken to the National Hospital that is here in Abuja. It is interesting to know that at each point in time that Nnamdi Kanu's medical checks was being conducted, the DSS will normally send 2 or more of their own in-house doctors to witness all examination, and they are fully aware of his medical condition. They are fully aware that since they kept giving him those medications they used to give him to improve his potassium, that it has not worked. His potassium continues to deplete, and this can lead to heart failure. The DSS and the federal government of Nigeria do not want Nnamdi Kanu to be taken to a proper medical facility where his health can be comprehensively taken care of. Even though no court has found him guilty yet he is being punished by refusing to help in building up his health. We want to tell Nigerians that it is only a man that is alive that can stand trial for any offense whatsoever. Nnamdi Kanu needs urgent medical attention. May I use this opportunity to also state that Nnamdi Kanu does not want to be discharged on sympathetic grounds. He does not want to be discharged on sympathetic ground. He wants to come out from this case with all the facts laid bare to the general public. And that is why he has urged that he wants to stand his trial, he wants to stand it as a healthy man, not as a man that is dying. And he does not want to be released because he is dying. He wants his health to be properly taken care of. And we are also saying, if the federal government does not want to take care of his health, probably because of the cost, Nnamdi Kanu and his supporters are offering to foot the bill of his medical health, provided we will be allowed to have proper medical attention. And we have also suggested, and we have chosen, and Nnamdi Kanu has approved, that he does not mind using the National Hospital, which is owned by the federal government and in the heart of the FCT also. Thank you very much. God bless us.
Thank you for your time with us today.
It's my pleasure having you.
Make I just start by asking this question. You don't see Nnamdi Kanu?
Yes, I met him yesterday for almost 3 hours at the headquarters of the DSS in Abuja. And we had quite an interaction, private interaction initially, and later on he was interviewed by 3 DSS officers in my presence. I wanted to call it an interrogation, but they said no, it's an interview, during which they asked him routine questions, but most of the questions centered on his being the leader of the indigenous people of Biafra and the activities of that organization. So he answered the questions in a relaxed atmosphere, with bearing in mind his constitutional rights not to incriminate himself, of course. Some of the questions had background information that he considered incomplete, and he told the officers that he was not able to answer some of these questions because the information that they supplied to him was incomplete.
Barrister Aloy Ejimako, thank you for your time with us today.
It's my pleasure having you.
Make I just start by asking this question. You don't see Nnamdi Kanu?
Yes, I met him yesterday for almost 3 hours at the headquarters of the DSS in Abuja, and we had quite an interaction, private interaction initially, and later on he was interviewed by 3 DSS officers in my presence. I wanted to call it an interrogation, but they said no, it's an interview, during which they asked him routine questions, but most of the questions centered on his being the leader of the indigenous people of Biafra and the activities of that organization. So he answered the questions in a relaxed atmosphere, with bearing in mind his constitutional rights not to incriminate himself, of course. Some of the questions had background information that he considered incomplete, and he told the officers that he was not able to answer some of these questions because the information that they supplied to him was incomplete.
If you describe to us when you see Nnamdi Kanu, how he be, what's his state of mind?
Well, his state of mind wasn't as sound as it should be. You know, if you listen to his broadcast, you would know that he's a historian. But when I was talking with him, he had trouble recalling the actual date he was abducted. It surprised me. So to jog his memory, I asked him how many nights he spent in Abuja before he was brought to court. He told me 2 nights. So he was brought to court on Tuesday, the 29th June. So we figured he must have been brought into the country on Sunday, the 27th. So when I mentioned that date, he said, sure, that's the date. But I took particular note of that. I also noticed that he had a visible injury on his right wrist. I asked him what it was. He said it was where they had chained him, put the chain on him, and chained him to the concrete floor in Nairobi, Kenya. And he has disappearing injury on the left wrist and an injury right here at the nape of the neck. He appears like somebody who has been mentally traumatized, you know, so he's unwilling to talk about one or two things until you prompt him. Like when I prompted him about the date, that's the conclusion I drew. How many nights he spent in Abuja. No, he's not. He's traumatized.
You could tell us more about what's happened, because you talk about, you just mentioned Kenya, and Kenyan government don't come out to talk, say they no arrest Nnamdi Kanu for Kenya. So tell us more about this.
What happened is this. Nnamdi Kanu entered Kenya, I believe, on a certain date, right around April this year. I'm not sure. I'm trying to establish the actual date of entry. But I have documentation from a Kenyan hospital that placed him in Kenya as of 14th April this year, 14th May. So he entered Kenya.
And what did he do for Kenya hospital?
He went there because he had issues with his heart. He felt he wasn't well. So he went there, he was examined, and the diagnosis was hypertension and heart murmur. They made prescriptions for him, and my examination of the medical report indicated medications for heart and controlling blood pressure. So apparently he entered Kenya before the 14th May this year. So he had settled in at a location in Nairobi, a temporary location, and he entered with his passport. That day, on the fateful day, that was on the, I believe on the 19th, yes, not believe, certain, 100%, he drove himself to the airport from his temporary location in Kenya. He drove to Jomo Kenyatta International and went into the garage, the underground garage, to pick up a visitor flying in from outside. Okay, that is not necessary for this discussion, the identity or whatever. So the moment he got into the parking lot, the garage, a group of several men well armed to the teeth.
And this now wetin Nnamdi Kanu tell you about everything you remember of wetin happened before they bring am to Nigeria.
This is what he told me, and his recollection of this was very, very lucid and clear.
Tell us about it.
Yeah, so now they swooped on him, they gathered and grabbed him, okay, in a very physical, rough way, and he raised the lamp. Luckily for him, there were a few people that were there, and the people wanted to intervene in terms of really very aggressive intervention, because to them, I asked him why they would consider making an aggressive intervention when something that seemed law enforcement was happening. He said perhaps they didn't believe it was normal. So the people that were abducting him told everybody to stay clear, that this person you're looking at is a Nigerian terrorist who assists the Al-Shabaab terrorists in Kenya. They grabbed him, put him in their car and left, and took him to a private residence, not an official detention facility, where they chained him to the floor. For most of the 8 days he spent there, and they really tortured him, thinking he was Al-Shabaab. So he kept telling them he wasn't Al-Shabaab. He had nothing to do with Al-Shabaab. He kept telling them who he was.
Who be these people?
Well, I asked him who they are. He told me they are Kenyan security officials. I asked him why. He said the insignia, the carriage, that he had arrived Kenya, so he had a bit knowledge of the terrain and how the law enforcement functions and the sort of things they wear, how, you know, that they were brazen with weapons openly. It couldn't have been private parties or, you know, some rogue agents doing that. He told me that the thing has it's, you know, 100% degree of officialdom to it. So they took him to that location, and they were torturing him, and I'm sorry to say they really beat him a lot. So, but at some point when he was trying to explain himself, he told me he was blindfolded most of the time, chained to the floor, bare floor.
But the Kenyan government don't clearly talk, say they don't get hand for this, and they know